I once saw a patient in my clinic who has been seeing multiple providers because she's having difficulty emptying her bowels. She thought she had constipation, has been taking stool softeners, eating her fibers, and yet nothing seems to help her to empty her bowel properly. When she came to see me, she explained something interesting. She mentioned that she has to use her finger to push vaginally to get stool out. Turns out she has something called rectocele, which is a specific kind of pelvic organ prolapse where the rectum, which is the organ where stool collects, is pushing through the vaginal wall. So in today's video, we're going to learn about what is a rectocele, what are some symptoms, and how can we treat it. Hi everyone, I'm Dr. Nabila Noor, board certified and fellowship trained urogynecologist and a pelvic reconstructive surgeon. Welcome back to the channel. If you're new and you like what you see, don't forget to subscribe and share it with a friend. In this channel, we talk about everything pelvic health, so keep watching. So what is a rectocele? A rectocele is a specific kind of prolapse or pelvic organ prolapse where the rectum is pushing through the vaginal wall. And why is that? That's because of weakness of the pelvic floor support structure, and as a result, the rectum is not staying in its place and pushing through the vaginal wall. So a lot of the times, patients will notice what feels like pressure or fullness or heaviness. So oftentimes I'll describe the vagina as a cylinder. Imagine the vagina as a cylinder. The top wall is known as the anterior vaginal wall. The bladder, which is the organ that holds urine, sits on top of that top vaginal wall. The back vaginal wall is known as the posterior vaginal wall, and the rectum sits underneath that posterior vaginal wall. So when you have a rectocele, the rectum, which is underneath that posterior vaginal wall, is pushing into that back vaginal wall and causing the back vaginal wall to balloon out. So what's actually coming outside the body is not the rectum, because there's no hole in that vaginal wall, but it is the vaginal wall that is being pushed because the rectum is pushing against that wall. So remember, in this patient story, we mentioned that the patient could actually empty their stool or empty their bowels by putting two fingers into the vagina and pushing that bulge back. The reason that's the case is because when you use your finger to push vaginally, you're basically straightening the anatomy, meaning pushing the rectum to where it belongs, and as a result, allowing the stool to come out through the anal opening. Now, why does it happen? Chronic constipation is a big risk factor. So for patients who have chronic constipation because their stool is hard, they're straining all the time every time they have to go for a bowel movement. So that constant pressure on that pelvic floor can cause those pelvic floor muscles to get weak, and as a result, the support of the vaginal wall is affected, and hence the rectum, instead of being supported where it belongs, pushes into that vaginal wall, causing prolapse to occur. Similarly, pregnancy or trauma from childbirth can also cause rectocele. The reason is that when women are pregnant, the pregnancy itself can cause a lot of pressure on the pelvic floor. And of course, the process of vaginal birth. As the baby is coming through the vaginal canal, oftentimes there are lacerations, which means the vaginal wall and the muscles underneath can tear. So if those muscles are torn, it can cause a lot of damage to those pelvic floor muscles, the nerves. So if not repaired well, then over time, those defects can get weak, compromising the support, and as a result, leading to pelvic organ prolapse. Genetics is a big risk factor, as well as being overweight or being on the heavier side. Again, same thing. Now, what are some symptoms patients will notice? Common symptoms being sensation of incomplete emptying of the bowels, not being able to get stool to move, even though you're using stool softener to improve the consistency of the stool. That constant pressure, heaviness, discomfort. Sometimes patients will even complain having pain with bowel movements. Feeling like there's a lot of laxity and looseness, and not feeling the tone of those pelvic floor muscles, and feeling like everything feels wide and open. These are all signs and symptoms of a rectocele, and maybe some perineal laxity as well. The good news is there are lots of treatment options, but the first thing and the best thing that you can do, especially if you're suffering with this condition, is to avoid risk factors. If you're constipated, work on improving the constipation. Improve your fiber intake. Make sure your hydration is well. Make sure you're taking stool softeners if needed so that you're not straining. Starting with pelvic floor exercises to help strengthen your pelvic floor muscles so it can help support the rectum better. there's a device or a vaginal insert called a pessary, which is a silicone device that usually looks like a little ring or a donut. Sometimes they come in different shapes and sizes. It kind of works like a modified tampon. You insert it into the vagina, and what it does is that it pushes the bulge back to where it belongs, taking away the sensation of heaviness, fullness, and hopefully allowing patients to empty their bowels properly. And of course, the most definitive treatment is surgery. The good thing about the surgical treatments is that they're all done using minimally invasive techniques through the vaginal opening with sedation, probably about 45 minutes to an hour at most. So there's no incision in the abdomen. Most of the incision is inside the vagina, and what patients see sometimes is just a few stitches in the perineal area, which is the space between the rectum and the vaginal opening. Patients go home the same day. Recovery is usually about 6 weeks of no heavy lifting, so nothing more than 10 pounds, which is a gallon of milk, and of course nothing in the vagina, so no tampons, no intercourse. Your daily activities you should be able to do even within that 6-week period. The sutures that we use usually dissolve within the 6 weeks, and once you've been cleared by your surgeon at the 6-week post-op visit, you go back to your normal activities. There's a lot of stigma associated with pelvic floor issues, specifically things like pelvic organ prolapse. These are conditions that women don't like to talk about because they're embarrassing sometimes, and truthfully, a lot of women may not even know that these are very treatable conditions. Hopefully after today's video, you learned about these conditions, and if you have a loved one or a friend that you know is suffering with these conditions, definitely share this video with them so that they can learn about these conditions, seek the help that they need, and start living their life again and get their quality of life back. If you like this video, don't forget to subscribe, and like I said, share it with a friend because we need to start having these conversations so that we can help as many women as possible take control of their body and get back their life. Next week, I'll be back with another exciting video about a topic regarding your pelvic health, so make sure to tune in. Hope to see you soon. Bye.